You're welcome back. It's our final hour here for a Saturday edition on Breakfast Extra. Now, in a recent turn of events, the Trump administration announced a temporary freeze on federal grants and loans, aiming to review and eliminate what it deemed wasteful expenditure. This decision was met with significant backlash, leading to a swift reversal. While this policy U-turn was or has dominated headlines in the U.S., its ripple effects are felt beyond American borders. Many developing nations heavily reliant on U.S. aid for healthcare initiatives, infrastructure projects, and also educational programs faced immediate uncertainty during the freeze.
And so this incident underscores a critical question. How vulnerable are developing countries to the policy shifts of donor nations? Well, to answer these questions and more, we're joined by Professor Oyewale Tomori. He's a renowned virologist, and he joins us to just discuss the potential impacts on global health initiatives and the lessons developing nations can learn from this episode. Sir, thank you so much for joining us. We appreciate you for coming on.
My pleasure.
Let's just get started and just talk about, the recent freeze and the subsequent reversal of the U.S. federal aid have highlighted the fragility of international support systems. And so I have to ask, from your perspective, how did this, temporary halt or freeze impact global health programs, particularly those combating infectious diseases for many developing countries depending on consistent aid for their healthcare infrastructure? What immediate challenges did they face during the funding freeze?
Thank you very much. I think the effect is going to be quite profound, not just on developing countries, but you also know that they're withdrawn from WHO itself. They contribute about 15% voluntarily to WHO activities. And then in different countries, like Nigeria, for example, I think about a year ago, they spent almost about $600,000, which is about almost $1 billion on health issues in Nigeria, malaria, HIV, even laboratory support, all those things. So it's obviously going to have very severe effects on us. But it's so surprising that we're surprised by what he did. When he came in 2016, he did the same thing. So why did we expect when he's coming back now, he won't do the same thing? We should have been prepared for it. We have been waiting too dependent on all these foreign things. And that's why we're where we are today. What is happening in America shouldn't be affecting what we're doing in Nigeria. If we're putting our money in the right place and spending our money well, we can do without all this so-called international aid. And I think that's the direction we should go. Talk about wake-up call. I hear that one. We set alarm to wake us up. As soon as the alarm rings, we switch off the alarm. It calls again, we switch it off. And that's what is happening to us in many African countries. We're too dependent on all this so-called foreign aid. And when you look at foreign aid, actually, as the Bible says, the man who is giving you the aid benefits more than the one who receives the aid. So what's wrong with us?
Professor, just based on what you have just said, from the past, what were the benefits for these foreign nations for helping Africa, especially when it comes to these funds? What were the benefits, and what were they expecting to get back? What, economically or socially, what were the benefits?
First of all, the benefits arose because we did not do our job. If we had done about well, they don't need to come in and give us any benefit. If our health system is working well, if we put the right amount of funding into health and not spend it on frivolous things, we don't need anybody to come and take care of malaria in Nigeria. We don't need anybody to come and take care of. So in a base of benefits, the individual person who gets that aid, the man who gets treated for malaria, the one who gets the samples tested, the HIV cases, the care, counseling that comes up. Those are the areas where the individual benefits. But let me tell you about international aid. I spent quite some time working with WHO. I'm telling you that 60 to 70% of whatever they bring goes back to them in one form or the other. If they're coming to your country and they're going to give you a vehicle, for example, they're not going to buy it from innocent. They'll go to their country. All those little things, which we assume that we're benefiting from, we're actually losing. I mean, they have paying their own people, and we are paying the loan. We're paying for the loan for it. I mean, it looks so stupid to us and to me. I don't know why we have not been so sensible about all these issues, about
Right.
foreign aid and all that.
Professor.
They gain better, more than we do. So
Let's talk about gains for us, shall we?
Yeah, go ahead.
Yeah. Now, this incident, as you rightfully put it, raises concerns about our reliability on foreign aid, but also it now puts a center our healthcare, whether it's at the primary level, primary healthcare centers, at the local levels, or even in general. Our patient-to-doctor ratio is pretty much one of the lowest in the entire world. There's also the Jackpot syndrome, which have hit the healthcare sector really hard, with a lot of brain drain in the medical sector. And so what can we do to build more resilient healthcare infrastructure, as a resilient healthcare system that can weather the storm? You know, there's infectious diseases. We have to grapple with public health concerns day in, day out, besides just the ones on the global stage, Corona or Ebola or the likes, SARS and the rest. There's also ones that are here, like cholera and the monkeypox. So how best can we build a resilient healthcare infrastructure system that can stand the test of time?
Order your priorities. Put your money where your health is, and not the way we're spending our health getting 15%. I don't agree with that figure, because I don't think it's realistic. But we can do more than we're doing. Nigeria is giving about 5% of its budget for health, of the annual budget. But if you look at that 5%, a large portion of it goes into recurrent expenditures, salaries for people, meetings, and all those kind of things. Reorder your priorities. Spend your money on the right things and on the things that we need to do. Create the enabling environment for your people to stay. My generation stayed because the environment was okay. I had something to do. Now the environment is topsy-turvy. And so when people say blame those who are going to diaspora, I said, why? The situation, what are they doing here? Wasting their talents. And they always say we should come back. If you don't improve the environment that dropped them away the first time, they're not going to come back. So I said, let's go back to basics. Improve those basic environment, the environment that make people to be able to want to stay and help their country. The way we get our budget. Again, I don't want to compare what they spend on the National Assembly and what we spend on health or the individual or on education, all those things. Those are the areas. And I started by saying, reorder your priorities. And you reorder your priorities, you put your. We can't continue to depend on foreign aid for all those type of things. Look at our budget. I keep saying it. Less than 5% goes to health. About the same amount goes to education. And yet our legislators spend much more than that. And when you look at it per capita basis, for 260 million people, you put a budget of how many trillions? For the National Assembly, for who are just on less than 1,000 of them, you put this amount of money. This is what I'm saying. Let us reorder our priorities so that we will not be dependent on other people forever.
I hear you there, Professor Tomori. Professor, please, this had us shaking in our boots, even if it was reversed, and I mean the freeze. Now, it gives you an idea of how big a funding we're getting from the U.S. especially. So the question now is, if the freeze was to be reinstated, what realities are we going to be faced with when it comes to our health care or those who need these fundings to be able to live?
I pray it's not reinstated, so we don't go back to the foolishness that we were doing before. There's a time for us now. I don't like Trump for some other things, but on this one, I think it's a good thing you should do. Many African countries should wake up and just take care of your problem. May he never rescind what they've done. Well, some people will suffer, no doubt about that. But we need to wake up and spend our money where it is. Where we depend. I think in 2024, I can't remember, the US, through their PEPFAR and other things, they spent about $600,000, which is almost about $1 billion. And you can take that, not just America alone. Go to Japan, go to Germany, go to UK. They are putting money into all those places where we should be putting our money. But we're so dependent on them. But I mean, I don't understand. It's not that they call us resource limited. They are not resource limited. We are resource wasteful. We are resource country. And that's what is happening to us. If this don't get this wake-up call, we will not know exactly what our problem is, and we will not find a solution to it. Until we begin to assume that we're resource limited and therefore we are handicapped and talking about equity, we are first wasting our resources, we are squandering our resources, and that's what is happening to us. So please, I hope Trump doesn't get this thing back. Let him keep his money. Let Africa wake up. Let Nigeria wake up. Spend his own money for his own people. That's what we need to do.
Right, well, in the realm of infectious diseases, right, we also have to look at infectious disease and put it into, which is, it's a threat to the human race and humanity. And we still, our public health system, especially our response to infectious diseases, is still very much on an all-time low. Don't we need the money? If you say that this freeze should still go on, what then happens to our immediate, which is very critical, the immediate response to infectious diseases? What happens then?
Let me tell you one thing. We assume we don't have the talent and resources to take care of infectious diseases. The money we are experienced. Nigeria took over, conquered Ebola in 2014, and all the cases came in, and through basic disease surveillance, handing over, decentralizing disease surveillance to the state level, to the local government level, getting to those basic things about contact tracing and those things, we conquered Ebola. There are 4 or 5 other countries in Africa that have done similar things, and we never hear about those epidemics. It is when we neglect those basic things that we have the epidemic that spread. So if you spend your money to prevent the epidemic in the first place, then you won't need anybody's support, because you will need the epidemic in the bud, and you won't spread to become an international concern. So our strength is in surveillance. It doesn't cost that much to put money into surveillance. In the days when we were growing up, states, local government level took care of their surveillance. Federal was just coordinating. Today, what we have a National Center for Disease Control and Prevention. But check them, they never even talk about the prevention. All we hear is National Center for Disease Control. If we focus on prevention, we probably won't have little to do to control. We will have the resources to control what we have. So the point is, let's don't go around and say, yeah, it is a thing of the world. But it's your problem. It starts with your problem first. It starts with you having your people. People are the ones that why are you waiting for global to come and help you?
Professor, I hear what you say about disease.
It's your people that are dying, and you have the resources to take care of those ones.
Okay.
Creating that enabling environment for your epidemiologists.
Professor Tomori, we're having a bit of an issue with the connection, but I'm hoping that you can hear me now while that is reestablishing. Okay. While that is reestablishing, I hear you talk about this disease surveillance and how well we did. Yes. I hear you talk about how well we did when it was the instance of the Ebola virus. We also did pretty well when it comes to coronavirus. However, you also talk about the fact that we have to invest in our health system. We have talents, you see. However, we are still struggling with an educational system that's not feeding that health system, whether you like it or not. If we're going to refuse these fundings, where do we start from? And in how many years? What's the timeline before we start to get results from our own systems, whether it's the educational system or the health system? So aren't these fundings for the time being necessary while we try and regroup, taking from the gains of what we did when it was the Ebola virus instance and adding that to our system right now? Wouldn't that be a better alternative than to just simply not receive funding altogether?
To cooperate. But there's also the need for you to do your bits. You don't keep depending on those people. Check the National Center for Disease Control. 3/4 of the equipment there are all from foreign people. How much of Nigeria's money is in NCDC? Let's go a little higher. In the African Center, how much of Africa's money is in the African Center for Disease Control? Perhaps a little higher. How much of Africa's money is in the AU itself? Those are the things we need to address. Let's stop deceiving ourselves and assuming that, we have to keep depending on these people. And I keep saying we have the resources. We are misusing our resources. So that's why I said this will be something that maybe wake us up and get us out of the stupor of dependency and move on to do something with what we have. We are wasting our resources. An entourage of 20 vehicles will follow a governor from his toilet to his bedroom. The Department of Epidemiology has no bicycle to even go and investigate. These are the things we're talking about. Well, I mean, so let's get out of this thing about foreign assistance or what I mean. We have the resources to take care of ourselves. I was on a road one day when the governor passed. Over 20 cars passed me, and I was going to look at an epidemic. The people don't have the bicycle to even go and investigate. And you are talking about this thing. Those people who are giving you money, they have sense for what they're doing. The fact that they're giving you is part of their own, call it obligation, call it trying to feel good that, you know, they are helping poor people like us. I'm not poor. My country is not poor. We are not poor. We're just being stupid and misspending our money. That's that message out to our people. Otherwise, we continue to remain where we are. And when Trump coughs in America, we start shaking here. Why should we? Are we not a nation?
Professor Tomori. Professor Tomori, I mean, I must
I'm
ask,
still here.
Yes, sir. So we need to build. You have said this, you know, numerous times that there is a need for us to build, and we have the resources. It's one thing to have the resources. It's one thing for a dire need for a rehaul or a revamp of our healthcare system. But there's also the will, the political will. And so I have to maybe ask you, what will be your call to action for our leaders, from the president down to the councillors?
We start with political will, but political will is a campaign thing. I will do this, I will do that. But you know, they never fulfill it. What we need is political commitment, more and above the will. The will has failed us. It's a wish, and they've said it. Let them look at what is happening. Don't our president feel ashamed when Biden calls all of them to America to come and sit down, and they sit down like school children, listen to Biden talk. And when they send to go to AU meeting, they send their ministers. Where's the priority? We need to keep telling our leaders, you know, tell them what they need to be told. We too, you in the press, me in this scene, we're too docile, we're too quiet. We let them get away with things they shouldn't get away with. And this message should go to them: wake up, Africa. Stop depending on Trump, on all those people on the aid on this thing. We will suffer initially in the infectious. That's what is expected. But we will then be resilient at the end. When we're spending our money well, when we're not depending on Trump to give us money to take care of our HIV cases. These are issues that you and I should be into. They get this message out. I'm kind of tired of all this nonsense that we're seeing with our leaders, where they just come and what they like.
Professor, we must say thank you for taking out the time to join us today. It's been quite insightful, your discussion with us. And we can hear your passion from your voice there and your submission. And it's very clear that in spite of pouring aid, there is a need for developing nations, whether it's Nigeria or other nations who are under the foreign aid for the U.S. to pretty much just get up and act now before it's too late. And hopefully this would spur some change that we so desperately need in our healthcare system. Professor Tomori, renowned virologist who joined us today, many thanks for doing this with us, sir.
Thank you very much, sir.